Joining us now is White House COVID response coordinator, Dr. Ashish Jha. Dr. Jha, welcome back to Fox News Sunday.
Good morning. Thanks for having me back.
How's the president doing this morning?
He's good. You know, I touched base with his team last night. That was when I got my last update. He had a good day. He worked a little, rested a little, finally listening to some of us on the advice to get some rest. And as of last night, he was feeling just fine. Haven't bothered him yet this morning. We'll touch base with him and his physician this morning as well.
You know, some people are asking, when President Trump was infected with COVID, when other presidents have had health scares, reporters were allowed to hear from and to question the president's personal physician. Why is that not the case here?
Well, first, since you draw the contrast, let's draw that contrast with President Trump and what's happened here. As you remember, with President Trump, it wasn't even disclosed for a while. We had very little transparency. The moment this president got infected, or we got identified as being infected, we put out a statement. You've been hearing directly from his physician every single day. I've been hearing from me every single day. And we're going to continue to make that information widely available. I mean, look, the president has an upper respiratory infection. He's doing better, thankfully, because he's vaccinated, boosted, getting treated. Given that scenario, you know, we have made sure that the American people are kept abreast of what's happening, and I think this has been an incredibly open and transparent process.
I mean, just to be clear, we've been hearing from the president's personal physician in typed up letters and memos. We haven't been hearing from him, and reporters haven't been able to ask the president's physician. I'm just asking why the different protocol here.
Yeah, I think, you know, the physician, the personal physician of the president has put out detailed reports of how the president is doing every day. I speak to his personal physician. I speak to the president every day. Dr. Fauci does as well. There's a whole team of us in constant communication. And then, you know, we're getting that information out to the American people.
Okay, people want to know, or wanted to know, where and when the president contracted COVID. White House Press Secretary Karine Jean-Pierre had this to say when asked about that.
Look, I don't think that matters, right? I think what matters is we prepared for this moment. If we look at where we were a year and a half ago, this is a president, when he walked in, one of his first priorities was to make sure we had a comprehensive plan to get people vaccinated. And so now today, look to today, more and more people are getting closer to having a more normal life.
Don't people around him think it matters if they were exposed?
Oh, yeah, absolutely. So we have a very comprehensive contact tracing program. You know, as soon as we identified the president as being infected, that program went into effect. Every single close contact with the president has been identified and notified. All those people are obviously being tracked. So absolutely, that's critical. I think the question that the press secretary was answering is, can we look back and figure out who infected the president? Very difficult to do that. It happened several days before, obviously, he developed a positive test. And, you know, the president's been out. He's been meeting with people. He's been meeting with Americans. And so it's going to be very difficult to trace back and figure out who gave it to him. But moving forward, everybody who was a close contact with the president, absolutely critical we're doing that.
So it's been a few days. Has there been anybody else in the White House or in his inner circle who's tested positive?
So as of yesterday, late in the day yesterday, which was the last update I got, there are 17 people who've been identified as having been a close contact. None of them have tested positive. Obviously, all of them are continuing to follow CDC protocols on masking and testing. And but as of today, no one that I know of has tested positive.
You know, it's great news about the president. I want to talk broadly about COVID here. The White House released this photo and video from the president tracking with some of the advice from former White House Press Secretary Jen Psaki in an interview. Take a listen.
What they need to do over the next couple of days is show him working and show him still active and serving as president. And I'm certain they'll likely do that.
And Politico puts it this way: the decision by the White House to treat the infection of the world's most powerful man with a still deadly disease as a mere nuisance echoes a larger political calculation the president's team has made to treat the pandemic as an unfortunate but manageable part of life. Dr. Jha, is that fair?
That's completely unfair. So let me be very clear. I mean, I spend all day, all night thinking about COVID and how we protect Americans. The decision of how we manage this president's infection is, look, this president is double vaccinated, double boosted, getting treated. That is why the president is having, thankfully, a relatively mild course. We're obviously going to hope that that's exactly how that continues. But the bottom line is there are many Americans who have not availed themselves of these life-saving therapies, have not gotten fully vaccinated and double boosted. I think it is absolutely critical. If you're over 50 and if you've not gotten a vaccine shot this year into the year 2022, you need to go out and get one now. If every American availed themselves of the protections that the president has gotten, which are available to every American, then yes, this would be a much different disease. That's not where we are, and we continue to work to make that a reality.
Here's the president from 1 year ago, Dr. Fauci from a few months ago, and then the White House press secretary on Thursday.
You're not going to get COVID if you have these vaccinations.
Virtually everybody is going to wind up getting exposed and likely get infected.
This is you know, at some point, everyone's going to get COVID.
Now, understanding that the virus evolves and there's been more contagious variants presenting milder symptoms over time, if the last two soundbites are accurate, Dr. Jha, why are there mandates, vaccine mandates, mask mandates, if everybody's going to get this thing?
Yeah, so a couple of things. First is, right now we do have an extraordinarily contagious variant, the BA.5, that looks like that's the one that also infected the president. It is widespread. The number one goal is to make sure that if people get infected, that they don't end up in the hospital, they don't end up dying. That is the number one policy goal we have. I think it's the right policy goal, and the best ways of achieving that are making sure people are vaccinated and boosted. And then obviously, if you're at all at elevated risk, if you're over the age of 50, have chronic disease, getting assessed for whether you're eligible for treatments or not. And I think a lot of Americans are and should be getting treated. That means that's sort of the number one goal. Obviously, we want to continue keeping infections down. Obviously, you want to prevent widespread infections. You want to do as much as we can. We're doing those things. We're encouraging mask wearing. We're making testing widely available. We're working on indoor air quality. Lots of things to keep infections down as well.
Mm-hmm. Just looking back, do you look at the biggest public policy mistakes up until now? Are you at that point where you're looking back? When you look at some place like Sweden that never locked down, but fared well, as a public policy issue, are you making the decision that schools should never have to be closed to in-person learning again? Are we evolving in the way we look at health policy?
Yeah, so we are absolutely always learning, right? That is the number one goal of any pandemic, is you look at everything you've done and you ask yourself, what have we learned about the virus? What have we learned about our response? What tools do we have now that we did not before? When this president came into office, less than half of American schools were open full-time to in-person learning, and that changed rapidly in the first few months of this administration because of the work of this administration. We are absolutely at a point where every school should be open full-time, in person, because we have the capabilities of keeping schools and teachers and staff and students safe, and that's the plan. And that's the plan we have been executing on, and that's the plan we will continue to execute on.
Last thing, Dr. Jha, the World Health Organization issued a global health emergency for monkeypox. Is this country going to do that? And what is the broader threat to the population?
Yeah, it's a great question. You know, the World Health Organization did this. I'm supportive of it. I think Dr. Tedros made the right call. We are seeing monkeypox in lots of countries around the world. Many of them not really being able to manage it. Here in the United States, we have a little over 2,000 cases. We have substantially ramped up testing. We have substantially ramped up vaccinations. We got to keep doing more, by the way. We're not done on that effort. We're going to do more of that in the days and weeks ahead. You know, whether we declare a public health emergency here or not will be based on the facts on the ground and what that declaration will allow us to do. No decisions on that have been made so far. We obviously will continue to assess that on an ongoing basis.
Do we know how many people have died?
No Americans have died of monkeypox in this outbreak. I don't know globally. I think it's a very small number, but 0 Americans have died of monkeypox.
So the risk to the broader population is pretty small.
The risk to the broader population is very small, and we're going to continue to work on making sure that we contain it in the populations where it is being transmitted and preventing it from spreading to others as well.
Dr. Jha, thank you for joining us today.
Thank you.